Hi everyone, my name is Dr. Paulo Antônio Almeida. I'm a psychologist. I'm here to help you to get rid of anxiety. Today I am talking about the behavioral methods for managing response behavior to get rid of anxiety. Is self how you to use the tools to help you to get rid of anxiety. I know it's challenging, but in this video, I'll show you the method called the systematic desensitization. Behavioral methods can be useful in a self-management problem, uh, in self-management program to reduce emotional behavior. One method is extinction, presenting the conditional stimulus, for example, a flying insect without the unconditional stimulus, stinging and associated response pain, thereby awakening the emotion fear. Fearful people anticipate the possibility of a conditional stimulus, such as insects that can sting, and avoid situations where these insects might be. As a result, extinction does not occur and fear persists. A self-management program to reduce fear can discourage the avoidance and encourage extinction of the behavior. Some people suffer from anxiety. They feel so anxious about to go out or to go into the events outside their home. And this technique, systematic desensitization, in which conditional stimuli are presented while the therapist and you encourage to relax when you are exposed to the stimulus that bring you the fear. To carry out this procedure, the therapist needs to create a list of conditioned stimuli that can elicit various levels of fear. Sting insects, and then arrange the list as a stimulus hierarchy. The conditioned stimuli are rank ordered from very mild to very strong for the intensity of the fear they would elicit. So the technique is help you to stay in contact with the kind of things that you feel fear in a step by step, little by little time, not in an aggressive way. An example of mild stimulus might be seeing a bee perched on a railing 5 feet away outside the closed window. A strong stimulus might be standing in a small room with a bee flying around. In this example, the client has enough room to stay away from it. Systematic desensitization combines these exposures with relaxation exercise. First of all, it's important you to training with your psychotherapy or in psychotherapies or here with uh, this video, you start to produce the relaxation exercise like breathing, meditation, muscles relaxation technique. For example, the therapist might first present the client with the mildest stimulus in the hierarchy and ask her to rate the intensity of her fear on a rating scale. This series of steps constitutes a trial in the procedures. The trial would then conduct repeatedly until the rating is zero for two successive trials. Then repeat trials would be performed with the next strongest stimulus in their hierarchy until the rating is zero for two successive trials. This procedure would continue until all the stimuli in the hierarchy have been addressed. Reducing a moderately strong fear is likely to take at least several sessions lasting between 15 and 30 minutes each. It's very important to realize that desensitization is like a desensibilization too, is a, a calm process that you take step by step with calm down, relax, because it's most important thing to treat anxiety is to get rid of anxiety is you to, first of all, you have peace inside your body and mind too. Relaxation techniques include progressive muscle relaxation and meditations can be used for reducing emotional distress. In progressive muscles relaxation, the client may pay attention to bodily sensations while alternately tensing and relax specific muscle groups. In my channel, I have one video about this technique, progressive muscle relaxation. For instance, the client might repeatedly tense and relax muscles in the arms, followed by the muscles in face, then shoulders, then stomach and then legs. Holding and release the breath can be included as well. In meditation, so in my channel, we have a lot of videos about meditation too, in English too. The client would contemplate our focus attention on an object, event, or idea. For example, he might focus attention on meditation stimulus such as static visual object, spoken sound or mantra, or in his own breathing. After practicing the relaxation technique for many sessions and mastering it, the client can probably shorten the sessions. In meditations, he could simply quit earlier, and in progressive muscle relaxation, he might eliminate or combine certain muscle groups. It's important, the idea that you is training day by day in a good way. Cognitive methods which modify one thoughts that serve as antecedents to emotional behavior can also be used to reduce emotions and beliefs in self-management programs. For instance, the client might think, I can protect myself against a bee, for example, which makes the fear stronger and more likely to occur. To combat this type of thinking, the therapist could instruct the client to make self-statements of two types. First, coping statements are declarations the client says to herself that emphasize her ability to tolerate unpleasant situations, such as relax, I'm in control because I can move away from the bee. Second, reinterpretative statements are things the client says to herself that redefine the circumstance, such as by giving herself a reason to view it differently. For example, she might say, the bee is not interested in me and won't be as long as leaves alone. Another cognitive method for reducing fear is distraction, such as shifting attention from a conditional stimulus that elicits an emotional behavior to other overt or covert stimuli. For instance, if the client sees a bee while outside, she could shift her attention to a beautiful flower or tree. I know this is hard for clients to do this alone. Because if you want to make an appointment with me to do a psychotherapy, please send me a message in my Instagram, Dr. Paulo Antônio Almeida, or in the email here, contato at pauloantonioalmeida.com.br, and I'll give you instructions about the psychotherapy, the session during 1 hour, and I'll help you to understand the context of your anxiety, and I will apply methods of cognitive behavior therapy to help you to get it off anxiety. Thank you. If you like this video, please subscribe and see you next video.